When you go to work and it's your passion, it's because each day you want to drive yourself to push the world forward. Helping you to find who you want to be, that's what drives us here at Penn Surgery.
Penn Surgery has a long and storied history of surgical education and leadership that dates back to the 19th century.
We cherish our past, but we're also defining the future at the same time.
We're really doing a lot of exciting things, and we're doing things across the continuum of what you can imagine.
Our residents in this program get a comprehensive training in all of the important pillars of academic surgery, namely research, clinical care, education, and innovation. When you leave this program, you certainly will be a leader in surgery with the capacity to advance the field in any way you see fit.
You would be hard-pressed to find any other academic set of surgical training programs that have produced as many leaders across the United States as we have here at the University of Pennsylvania.
Whenever anybody's going into like a surgical training program, they're thinking about technical excellence. And I would say the feedback that's provided intraoperatively, like what we get from our attendings in terms of the movement of our hands, the positioning of our body, how we approach the operative experience, the intraoperative space, is really unlike anything. You know, it's a constant dialogue. They make sure that you execute your movements as best as you possibly can and make sure that you're preserving the integrity and dignity of the patient throughout. They're my patients, even though they're my attendings patients. And I think our attendings really hold us accountable to that.
Confidence in surgery is a funny thing because as soon as you get comfortable on a rotation, you switch rotations. As soon as you learn one procedure, there's another one to learn. Penn gives you graduated responsibility. So as an intern, you always have someone who has your back, and that goes from senior residents all the way up to faculty. And they give you leeway that you're able to learn your limits, know that you can always call for help. That allows you to gain confidence and become more comfortable in increasingly complicated situations.
I think one of the most rewarding things about practicing at Penn and in Philadelphia is the ability to see both depth and breadth and acuity of clinical care in a relatively underserved area.
Operatively speaking, we come out of this residency with very strong skill sets. It's a testament to the volume that we see, the complexity of the cases that we have.
Our residents benefit directly from that robust clinical experience, such that when they graduate from this program, they are outstanding clinicians and proficient surgeons ready to go out and carve their own path.
Penn is an oasis of education and opportunity.
Our approach at Penn Surgery is really to try to help people understand their own passions and motivations and unlock the skills and the tools that they need through both experiential and formal training so that they can go on to push the field.
The leadership here is really supportive of, honestly, whatever you want to do. I'm getting my master's in business administration. I'm planning to become a breast surgical oncologist. But I also passionately believe that clinicians need to have a stronger role in leadership positions within hospitals and health systems. That wasn't something that had crossed my mind until I came here. Penn has taught me to think bigger and push myself more than I ever had before.
Both from a personal standpoint and a professional standpoint, Philly's really been an ideal city. It's a great place to practice medicine. I think there's every kind of different type of clinical site you can want. You learn at a VA one moment, and then you have the world's best children's hospital right next door.
It's an extremely affordable city. There's great food, amazing apartments, tons of history. My first morning here on my visiting rotation, I discovered the running trail along the Schuylkill River. And I remember standing there and having this really vivid moment of like, I can live here and be happy here.
One of the most important things to me when I was looking for a job was evaluating the people and the culture within a program. And I think that's one of the things that makes Penn special. There's no one right person for this program. We aim to recruit a diverse workforce that reflects an expanding patient population, especially here in Philadelphia.
The diversity in the teams is critical. Diversity of thought, diversity in race and religion and ethnicity. It's a place where I have felt included, and I think anybody coming from a lot of different backgrounds could feel included.
My co-residents and I are very close. I can come to them for anything, and I think that's what you really need in a residency program because you're going to be with these people more than anybody else.
When you walk away from Penn Surgery, you bring with you the rich network that you've created during your time here, and we will follow you forward, trying to provide support for you at all levels of your career.
You're going to be an expert surgeon. You're going to know how to take care of a wide range of diseases and critical illness. You're going to understand a philosophy of approaching education, and you're going to have the ability to perform well in research, you really will be completely equipped for the rest of your career.